So first, for starters, for people who may not be familiar with endometriosis and what it is, can you just kind of give me a brief explanation of what this condition is and how it affects women throughout the world here?
Sure. So about 1 in 10 women are affected. And what happens is that there are cells that line the inside part of our uterus that are meant to be stimulated only inside the uterus when we have a menstrual cycle. What happens with endometriosis is that those cells end up growing outside in the pelvis, and they can grow on the outer surface of the uterus, the fallopian tubes, the ovaries, or even in the lining that is in our pelvis and our abdomen.
For sure. I guess like, can you give me an explanation of if someone is diagnosed with endometriosis and if
Mhm.
this inflammation is noticed and seen, I guess how what can that ultimately like how what kind of effect can that have on a woman's health?
Sure. So it can vary. And I think that's one of the most challenging things about endometriosis is that once the diagnosis is made, it doesn't matter how extensive the endometriosis is correlated with how severe a woman's symptoms are. But the most common symptoms are heavy and or painful periods. There can be pain with intercourse. You can also have pain when your bladder is full or when you are having bowel movements. And those symptoms can occur either while a woman is menstruating or even in between periods.
What are some of the risk factors for endometriosis currently?
Yeah, so risk factors that we know about are women that start their periods at an early age and or women that end their periods at a later stage in life. Also women who have an increased amount of estrogen in their system, women whose family members have been affected, especially mother, grandmother, aunt, sister. We also know that women with a low body mass index actually have a higher risk of endometriosis.
For sure. You mentioned a few symptoms earlier. I'm curious, kind of at what point should a woman start seeing a doctor if she starts to experience some of the symptoms?
Sure. So if a woman is having heavy, painful periods or pain with intercourse, these are always things that we ask about at well woman visits. But especially if somebody is noticing this is the time to bring it up. Please don't be hesitant or embarrassed in any way to talk to your gynecologist or your primary care physician about those symptoms. Because at that point, then we can start doing more of an evaluation and talking about treatment options. The worst part about endometriosis is that it is a surgical diagnosis. So we can suspect it, but until we actually see it with our naked eyes, usually with surgery, we're working on a presumptive diagnosis. But again, that's something to talk to us about so that we can go forward with maybe some treatment options.
What are typical treatment options that are prescribed to patients who do go in for endometriosis
Sure.
treatment?
So really, we try and go with medical therapy first. And so medical therapy can be either hormonal or non-hormonal with scheduled non-steroidal pain medications like Motrin or Aleve, or even a prescription non-steroidal anti-inflammatory drug. Some women do very well with birth control pills or Depo-Provera injections. There are also newer treatment options on the market with a drug called Oralissa. For women who are really wanting to become pregnant in the very near future, those are women who then we talk about potentially doing surgery to evaluate and see if the endometriosis is going to affect their fertility. But we really try to stick with the medical therapy rather than going to the operating room. If a woman has a bad history of endometriosis or is really struggling with symptoms despite medication, and she has completed having her children, then we do talk about the potential for a hysterectomy.
For sure. And for those who aren't aware of hysterectomy, does that mean that, just to make sure I understand the definition, that means that the uterus is removed, or am I misunderstanding that?
No, that's exactly what it is. So a hysterectomy means removal of the uterus. It can also involve removing the cervix, the fallopian tubes, and potentially the ovaries if those are involved in endometriosis.
Sure. Um, And as we discussed earlier, as this is National Endometriosis Awareness Month, I'm curious. Like, I feel like since this month has started to be observed, has the do you feel that the awareness of endometriosis and kind of what women should do in situations where they think they might have be experiencing the symptoms or need to get checked out, like, do you feel like awareness has improved since this month started being observed?
I don't necessarily notice that with the month of March in particular, but definitely awareness of endometriosis and symptoms has become more prevalent in the last several years, due mainly in part to some of these new medication treatment options that are available. And also women who just know that endometriosis can affect their day-to-day life, can affect their fertility, can affect how they function, especially during their periods.
um there are uh some things that, like, a lot of people are typically encouraged to go and get screenings for, like, like colon cancer or things like that. Should women, I guess, is there a point where they possibly should consider being, like, preventatively screened for endometriosis, or is this really just kind of something that happens if you start to experience symptoms? Like, is there like a preventative way to approach this, or no?
Well, I think annual exams for young women who are having problems with their menses is a very important time to start the screening process. And so again, that's kind of part of our questions whenever we see a woman for her annual exam is talk to me about your periods. How painful are they? Do they affect your life? Do you have pain in your pelvis or your abdomen in between? So really it's more just preventative women's health in general that we start seeing women for and really asking questions. And unfortunately, sometimes it's only when we start asking questions that we really start to understand that we might need to suspect endometriosis and talk about, what we need to do to help you.
Sure thing. Dr. Winter, those are really all the questions that I had to ask. Is
Okay.
there anything else you wanted to mention that we might not have discussed, or anything else that you would mention in terms of just in endometriosis and treatment in general, or anything like that?
I think, again, one of the important things is just knowing that it is a surgical diagnosis and that the amount of endometriosis that is present at the time of surgery does not necessarily correlate to the severity of a woman's symptoms. I have seen women who are very much struggling and we do surgery and don't find endometriosis, but not a lot. And then they feel badly. And I always try and explain, no, it does not matter how much is found. It is the cycle of inflammation in your body. And then I've had women that I've done surgery and they have extensive endometriosis and they really don't have a lot of symptoms. So I think understanding that for women is very important, not to feel that, they should minimize their issues and problems and really to talk to us about it because we do have treatment options that can help you.